And could you briefly review the major side effects of the CT regimens and what are the most bothersome to patients?
Well, FOLFOX has some side effects, which the most notable being sensory neuropathy, a phenomenon where usually for the first 3 to 5 days after getting oxaliplatin, they will notice sense of pins and needles in their fingers if they touch something cold. It's obviously reversible. It usually dissipates after about 3 or 5 days after chemotherapy, and rarely do patients ever quit FOLFOX because of that side effect. The other important thing to note is a more cumulative sensory neuropathy that occurs with months of oxaliplatin administration, where then they start complaining not of episodic, but sort of longer-term persistent numbness in their fingers or toes. Were that to happen, then certainly we consider initially dose reduction of oxaliplatin, and then thereafter discontinuing oxaliplatin. In the context of patients with metastatic disease, we almost never give more than 12 cycles of oxaliplatin, such that if they're continuing to do well on FOLFOX and they're approaching 8, 10, 12 cycles, that's a circumstance where we're likely to stop the oxaliplatin and just continue the 5-FU leucovorin and the bevacizumab, with the idea that you could reintroduce oxaliplatin were there to be progression. Beyond that, the other side effects that we see with FOLFOX are common to most chemotherapies, namely some fatigue, some occasional reduction in blood counts, nausea, which is usually well controlled, rare events of diarrhea. So really the neuropathy is the one that I think patients would notice. In contrast to FOLFIRI, which is an irinotecan-based regimen, we don't see neuropathy, but the concern about irinotecan that we're aware of is the issue of gastrointestinal side effects, which frankly have been overplayed. When irinotecan was first developed, there were very high rates of diarrhea associated with the drug because we were using schedules and doses that we no longer apply in the FOLFIRI regimen. So in fact, the rates of significant diarrhea for FOLFIRI are in the range of 11 to 13%, sometimes less, and usually handled quite well with standard remedies like Imodium or Lamodal. So that's sort of the unique thing about FOLFIRI. The other important thing to be aware of is that about 1/3 of patients who get irinotecan will experience alopecia, hair loss, which is reversible. Some patients do object to that, and so might want to start with FOLFOX rather than FOLFIRI, recognizing that the majority of patients who get FOLFIRI don't get significant hair loss, but some do.
And to what extent do you consider treatment effects on patients'